wants to be the person to share?
I nominate Terabici.
I'll take it. All right. I was quickly jotting down notes at the end of this. So it was a wide-ranging discussion. I would say we started with initially talking about data missingness and intake, participant and researcher hesitation, and ways to potentially mitigate that. We touched on the thorny topic of race as an identity and shared experience versus a biological risk factor, and basically how it intersects with lived experiences like structural racism and how social determinants of health may be complementing that. And then we talked about, when collecting SDOH histories, thinking about collecting the ones that will actually be affecting or presumed to be affecting your outcome just based on the large volume of options out there. As far as options of SDOH screening tools, we talked about HL7's Gravity Initiative, Phoenix, like Dr. Duran mentioned earlier, two good resources for SDOH kind of discussion and standardization. And then we didn't have enough time, but we would love to talk a little bit more about community engagement, education, trust. And we ended the discussion mid-sentence about consent for data intake, both for research and for even just care in the EHR, and how that data is going to be used to build potentially biased AI models downstream. Sorry, that was facetiously said, but you know where I'm going with that.
Great. Thank you. Anybody else from the group want to add to that? Or you can chat in if you don't want to unmute and talk in front of a large group. Some people are more comfortable with that than others. But if anything that Dr. Terabici left out that you want to share with the group, feel free to chat that in or just respond to what he just said. But thank you. That's fantastic. Yeah, and I know that some of the breakouts, you're in the midst of a conversation and then you have to come back. So unfortunately, that's where we're at. But hopefully it'll lead to other conversations. Well, thank you. Next, we'll hear from Dr. Alberti and Dr. Walker from the Health Equity Research Implementation Evaluation Breakout. I don't know which one of you wants to report out.
I'm going to follow Dr. Duran's example and nominate Dr. Walker. I was so engaged I wasn't jotting down the notes that I probably should have done.
Sure. We also had a pretty wide-ranging conversation that started first around sort of gaps in data and how that can be a limiting factor when we are trying to transition to different generations of public health and health disparities research. And then we spent a good amount of time talking about gaps in education and training, particularly among care providers that may be places where we can sort of plug in as to train sort of the new generation of culturally aware and culturally humble health disparities and healthcare researers. Feel free to jump in, Dr. Alberti.
I'll just add one thing. Yeah, no, thank you. One of the things that really jumped out to me was an early part of the breakout. We talked a lot about the organizational infrastructure that's required for authentic community engagement in a longitudinal way that's not tied to individual projects. Infrastructure ranging, yes, from data, but to kind of fiscal policies and incentive policies and promotion policies and kind of accountability for that work. And so we did spend a lot of time thinking about kind of those organizational competencies around authentic engagement.
Great. And were there examples of how that's, I'm just thinking about this, the promotion piece. Were there examples of folks that have put something successful into place related to promotion that you've seen or you guys discussed in your group? Or just the need?
We didn't discuss it, but I am aware of some institutions that have actually kind of expanded that service requirement to really focus on community-centered scholarship or even just partnership outside of any kind of scholarship. And so I'm happy to pull some of those together, but we didn't spend a lot of time talking about specific examples of institutions.
Great. Anything to add? If anybody has anything to add to what Dr. Alberti and Dr. Walker just said, feel free to chat it in. But thank you. That's great. What about, I'm doing group 3 because actually both the folks had another meeting at 1:05. And so I will do my best to share some of that discussion. There was a lot of discussion about how do you train and prepare folks to advocate and how that can be a challenge given, especially in, I guess it really is a challenge anywhere, is time. If that's not your job, how do you find the time to do that? And then in addition to time, there was issues around training, like who do you reach out to for a change in policy is often challenging to figure out. And then there can be the challenges of frustration when you reach out and have some challenges in anybody doing anything. So I think there was some discussions around that. We did talk about the importance of community engagement and patient engagement in that advocacy work. And so having those folks as part of the research team, of course, ongoing, both co-creation and ongoing and dissemination, but also that having that community engagement will help in advocacy work because for a couple reasons. One is it can make people more attentive to the advocacy work that's going on, but also many community organizations already have capacity and built up advocacy activities. And so leveraging those activities and enhancing those as much as you can be a way to make a difference. So there was a lot of discussion around that. We did also just talk about more generally about, we did talk more generally about just building the trust in communities and partnering with communities that we also found in some of our earlier breakout discussions this morning, and the importance of that, as well as the dissemination and action from the work. And so I'm probably maybe short shrifting or leaving something out. So if anyone from our group wants to add a comment, they are welcome to do so. Okay, or you can chat it in too. All right. Well, that's fantastic. Thank you to our presenters and our moderator catalysts and scribes, as well as all of you for bringing yourself to the discussion and talking about things that you had the most interest in today. So wanted to acknowledge that as well. So I think with the remaining time, we will do I'm looking at my agenda again. This is the part where I'm going to try and do my best to synthesize some of the whole day for you. So that's always a challenge. But before while I'm doing that, while I synthesize a little bit the earlier sessions, and then in the context of what was just shared, it's also an opportunity to add more to the conversation. And so so I'd love for you to, as I'm sort of talking through some of these things, feel free to add your thoughts or comments on any of it in the chat. And then I'm going to ask at the end, if there's one thing that you want to share with the group in the chat around something you might use from these breakouts or discussions that you've heard today that you might use or think about in your work as you move forward, to chat that in. So you can think about that. I'll ask that question again after the summaries, but that will be something I'll ask for you. So with that, I'm going to just try and summarize all this great discussions from the day, and thank everyone for all the comments, discussions that we're going to take note of and compile, and hopefully be able to use a lot of this in the CTSC work as we move forward as well. So I'll share some of the things that came up in the morning sessions. So there was a lot of discussion around co-creation with community, creating a space for voices to be heard in the community. And that might mean partnering with a community organization that already does that very well. True long-standing partnerships, and not just the in and out that sometimes happens in research. People talked about the use of community advisory boards or having community partners as part of your research team. And it can also be, some workforce development around having folks from the community as part of your research team. So those are some things that came up both in the morning and a little bit of that in the afternoon as well. There were some discussions about the best ways to engage community, sharing the why of why you're meeting with them, meeting each other where everyone is at, and giving power back to community, not just coming in at the end and asking for their support. There was some mentions about community health fairs and community events as one way to be seen in the community if you do research. But again, ways to just continue to have visibility in the community and engage with communities over time. There was some discussion about the EPIC electronic health record data as a natural data source for many fairly qualified health centers who want to participate in research. There was some work around digital inclusion and to be thinking about that in the work that we're doing and making sure that communities have that access is so important and it's part of health. There was some discussions around alternative medicine and how does that fit into the research and the activities, bringing health and healthcare to community, not just expecting them to come to you, and having help available in the community to do that work. There was some discussions around the closing the loop. When you have results and dissemination, making sure we disseminate that back to communities, that there's actions applied to help communities with the work that you're doing. There was discussions in the morning and then in the afternoon about advocacy and partnering with community organizations can enhance your advocacy work as one element to that, as well as I mentioned, some of the time and training that's needed for that. There were discussions about collaboration with partners, so across the CTSC as well as others. We don't all want to be coming at community partners with the same kinds of questions, and how do we ensure that we try and are coordinated and careful about our work with communities. And then there was some discussion this morning around how do we support and fund investment in community engaged research and payment for community partners as a piece of that. That did come up again in the afternoon as well. And, having that integrated even within NIH, that there is the importance of payment to community partners and engagement of community partners. Most of the things that we talked about in the morning were repeated in the afternoon. I won't just repeat the report outs, but around data missingness, reporting hesitancy, and social drivers of health and ways to incorporate that, but also doing those data pieces in partnership with communities so they don't feel like it's out there and another sort of mistrust is built as opposed to trust. And then I think sort of, as mentioned earlier, organizational infrastructure needed, both incentive, training, fiscal promotion, et cetera, accountability. So I think those are the main themes I wrote down. I'm sure there's something I missed. I saw that in the comments. Thank you. We prefer the term integrative medicine or whole health versus alternative medicine. Fantastic. And then any other comments, pieces or parts that anybody wants to share, big takeaways that I forgot to mention? All right, well, I'm going to leave with my question that I started earlier, and then we'll do a quick logistics ending wrap up. But So again, thank you to all of you, to all of our presenters, to our planning team, especially Jalise Thomas. And then I wanted everybody to chat in what's one thing you think that you're thinking about now as you do your work. It doesn't have to be research. What's one thing that's sort of at your forefront that came up from these discussions? I'm just going to wait a minute while everyone chats that in. Great. I see some comments, data from the electronic health record, being some challenges with that, making more connections with people working in this area. Great. What are our organizational competencies for building and sustaining research partners with communities? That there are so many people in Cleveland working in this mindset and desiring to. It's a great comment. Important to teach health professions, education students to value this in their profession. Great to hear how the community and research can co-create. Yeah, one person was asking about, we'll follow up with Dr. Alberti about, yeah, some of the exemplars that he mentioned. Great. Amy's talking about need a broad discussion about optimal uses of my chart and how we can train patients to use it. Sustaining community partnerships, having more representation in researchers for minority populations. Great. I'm probably missing one or two, but this is fantastic. Any last thoughts you want to let us know, keep writing them down. So that's fantastic. Leveraging EHR data to reinforce what we are hearing in the community. Yeah, how to work with groups that don't use electronic records or Wi-Fi. Great, and I see we're using the likes or the claps, so that way if it's something that's really important, you can, so it's good. So I don't know if that counts as social media. I'm not a social media person, but I love it. Keep doing it. Fantastic. So I think with that, again, feel free to keep writing in things that are striking for you. I want to do, we'll end the session and thank everyone for attending. This session, again, it was around sparking conversation, not solving everything today, as you'll see, because I know there were a lot of rich discussions and we did not get through all of them. But I think this gives us some elements for continued exploration and work. So I want to really thank everyone for joining with us and sharing all their thoughts. Just a reminder again that the program is worth 4 hours of CREC, and if you confirm your attendance by completing the survey at the end. So there will be a survey link that was just put in the chat. Thank you, Jaleese. And there'll be one sent by email afterward as well. And yes, these will be posted on YouTube, the CTSC YouTube. And I know we had a slide for that earlier, but just if you go to the CTSC YouTube, is it Shannon or Jaleese, is it CTSC Cleveland YouTube? Maybe you can chat it in just so it's clear. But that will be up shortly after. It's not right away, but we will have the recordings there if you missed any part of the program that you want to see. And then, firewall friendly issues. We'll let Jaleese and Shannon know, but you will get an email too with the link. So hopefully that will help. But yes, I know sometimes there's some firewall issues. Feedback is important to us. And thank you, Jaleese, you put the YouTube channel. And hopefully we can resolve the issue with the link and the firewalls. Speaking of EHR data, etc. Anything else, Jaleese or Shannon, that I need to mention before we let everyone go for the rest of the afternoon? Anything I'm forgetting?
This was wonderful, and a big hearty thank you to you, Dr. Bolen, for leading the charge. This day has been extraordinary, and we are so grateful to have had all of the people on the call and for this to be the conclusion of our Mission Health Equity Challenge series. Thank you, everyone.
Thank you. Have a good rest of your afternoon.
Thank you.